Welcome to Coruzant Technologies, home of the Digital Executive Podcast.
Welcome to the Digital Executive. Today's guest is Terrence Sims. Terrence Sims is a career healthcare technology and operations executive with more than 30 years of senior leadership experience in both early stage and Fortune 500 environments. Terrence joined Raintree in 2007 as Chief Operating Officer and currently serves as the President of Strategic Growth and Marketing.
Well, good afternoon, Terrence. Welcome to the show.
Thank you, Brian.
Awesome. I appreciate you jumping on, Terrence. This is a little late in the day, but I love this because no matter what time of the day it is, it could be at 4 a.m. my time or 10 p.m. my time. I just love doing podcasts, meeting new people. So thank you. And so, Terrence, we're going to jump into the questions. You've got quite the background in healthcare, tech, senior management, and now you're the President of Strategic Growth and Marketing at Raintree Systems. Could you share with our audience what drives you and what has contributed to your success?
You know, it's rare, but exciting that you find the convergence of technology and in healthcare in a more practical way. I'm really driven by how that enables, the delivery of care and making things easy in the healthcare marketplace. Not just healthcare, but that's where I focused the overwhelming majority of my background. So that convergence between the business where patients are getting treated by providers and how technology can make that easier, simpler, more automated. I have a great passion for that. And that's been what really has fueled my career.
Yeah, I appreciate that. And by the way, just to throw something in here, our readers will listen in, but I actually did a lot of work with your company back probably about 20 years ago. We were a nationwide medical billing clearinghouse. You probably were familiar with maybe IMS or Proximid back in the day. They bought out and sold since then. But yeah, I worked in Orange County for a while and we did a lot of work with you also. Just a little tidbit there. But yeah, I love healthcare. So Terrence, as you know, everybody globally has had to make major shifts to adapt to this new normal in the pandemic. Could you share with us what you're doing to help your organization stay relevant in this economy?
So a little bit about Raintree. We are a low-code or no-code application development platform. So that's what has enabled us over the past, 25, 30 years or so to be pretty agnostic when it comes to specialty and or vertical within the healthcare segment. We've built and been able to amass a nice collection of tools and capabilities from a technology standpoint, and being able to meet and interact with entrepreneurially minded investors and provider groups and medical systems and understand what their business challenges and opportunities are enables us to go into that toolbox and pull out the right things and create solutions for them. How that has prepared us for the time we're all living through right now is profound, because we're at that stage in the evolution of care of the healthcare marketplace where for the first time, we're having to really get super creative about how technology can enable the actual delivery systems for care, meaning historically that has always been people interacting with people. And now we're really starting to explore how technology can facilitate the delivery of care, enabling the application of service or the delivery of service to the patients in need of those services. We saw the advent of this with telehealth years ago, but it has quickly moved well beyond that with wearables and with the ability to monitor, remotely remote patient monitoring and really delivering more of a virtual care type of an experience. So what we've been doing is we've really been focusing on how the technologies we've built can enable the actual healthcare delivery models that are starting to be contemplated throughout the country.
I appreciate that share. And Terrence, during the pandemic, we just talked about this is a good segue. Many providers needed to reevaluate their healthcare practices and pivot to this sudden demand for virtual care. How have you and Raintree helped specialized healthcare practices adapt to the challenges of implementing digital healthcare technologies?
That's an excellent question, actually. It's funny and not so funny at the same time, just because of the profound seriousness of this pandemic. But there are multiple professional groups that are out there now that are looking for very creative, but yet different ways of serving their patients. And one of the things we've done within the context of your question specifically is around how providers engage with patients. Now, everyone knows that patient engagement has been a new thing that has been evolving for the healthcare industry for the past 3 to 5 years, but it has taken on a different type of definition now, because engagement does involve technology, but not just as the platform, but technology as the facility for connecting the provider with the patient. And one example that arose during COVID was really around mental health, believe it or not. We have a relatively new client that has hundreds of providers throughout the country, and mental health providers that have historically treated their patients face-to-face, but they have moved their entire business model to virtual care. And we were able to, utilizing those tools, develop develop a clinical documentation in a platform with telehealth embedded and literally enable the patient to be wherever they want to be on a mobile device or tablet or stationary, and they still be able to get the level of support they need in times like these when we're socially isolated, socially distanced, and living through a pandemic. So it literally is being able to have the interactions with those that are finding the challenges in delivering the services and understanding that well enough to create the right solutions, albeit being facilitated via digital platforms. And I really fundamentally believe that these types of differentiated delivery models is what we're going to see more and more of over the next 5 to 10 years.
That's awesome. I appreciate you sharing that. And I wanted to dive in, Terrence, if you don't mind, just a little bit more on the tech side. This is really our last question, but you're obviously leveraging some new and emerging technologies within your tech stack. Is there anything you can share with our audience? And maybe not, maybe there's a cool tool or app you're leveraging that you might be able to share with us.
Probably the most profound thing that we're doing right now in relationship to cool tools is the way that we're able to work with a number of point solutions out there, and as a technology partner, bring this stack into their ecosystem and enable interoperability and ease of developing quick web applets, for example, that can sit on top of your request for medical records or your ability to process payments with relative ease and making it super convenient for the patient. Those types of point solutions almost always lack that extra edge of technology. So what we've began to do is really seek out those that have great solutions, but could leverage us as a technology partner to create things that better align their solutions with this trend towards consumerism in healthcare. So one of the things that we're really big on is how to get direct to the consumer, the patient, because we've been seeing this evolution in healthcare over the past 10 years, thereabouts, where it does matter how much we're spending for our care, and it does matter who's going to provide the best value for the care they're proposing. And we do want choice as consumers, even in healthcare. We don't want to just go where our primary care physician tells us we should go because that's a relationship they trust. It's important for the patient to take great responsibility for their care. So access to data, access to information, and being able to have voice interactions and self-help digital intake, as an example, is one of the most profound things that we've done in that, you can do a degree of self-assessment and determine, hey, a home exercise program is probably what I need, but based upon this digital intake and this self-assessment, I need to get in and see a physical therapist. And then we provide you a way to find a physical therapist near you and have them maybe even pitch for your business. So we're thinking in those contexts, and we know that we can't do it all, but we have the technology to enable it. So our goal is to try to partner up with those that have those point solutions. We will provide many of them directly as well, but we are seriously interested in allowing people to just license our technology and get out there and start serving the community in the ways that you're committed, and we'll be your technology partner.
That's awesome. Terrence, as you know, I've been in healthcare probably 20 plus years, and this is the type of stuff that really excites me. And I appreciate you sharing what you're doing with your customers to improve that patient care delivery. So Terrence, thanks again. And it was a pleasure having you on today. I look forward to speaking with you real soon.
Hey, Brian, thank you. It was great having the opportunity. And I too get excited about all of this.
Bye for now.